Quentin, good to see you again.
Hi, Jorge. Good seeing you too.
Excellent, excellent. So listen, I wanted to talk to you today about your business plan and your team's business plan. First and foremost, I want to congratulate you and your team on exceptional execution of that business plan.
Yeah, thank you very much.
But what I'd like to do before we talk specifically about the execution is I'd like to ask you a few questions about the diagnosis piece, which, as you know, is so important. Can you talk to me a little bit about how you diagnose the opportunities that were in your business plan?
Yeah. So to be honest, Jorge, when we started this whole new ways of working, I was a bit confused about whether we can talk about sales, can we not talk about sales. But I think with the coaching support you've given me over the last few months, it's now very clear in my mind that, yes, absolutely can we still talk about sales. We can use sales to analyze our business, understand where the opportunities are, but we will not be using sales for any incentive purposes or reward purposes. So that's very clear for me now. And what we've been doing is we've been analyzing all of our data that we have, market share, brick share data, to look for future opportunities of where we can drive the business. And what we need to do is, in these future opportunities, we need to make sure that we drive it in an appropriate way where we can get access to more patients in an appropriate way for our business.
That's great. It sounds like you're using data very appropriately to find where those opportunities are to help your customers provide our great medicines to more and more appropriate patients. That sounds wonderful. And can you imagine how challenging it would be to find those opportunities without having the data?
Absolutely.
So what I'd like to do now is shift over to the actual execution, because not only did you and your team find those tremendous opportunities, but you also were able to execute the specific objectives that you set for yourself from an activity perspective. Talk to me a little bit about that.
Well, absolutely. I mean, we clearly have very clear dashboards in place. As part of our KPIs, we have reach and frequency, we have scientific knowledge scores, all of those sorts of things are in place. And what we are doing now as part of the business planning process, we are using an account planning template. So my representatives are giving me a weekly planner that I can see exactly where they're supposed to be, which hospitals are supposed to call on, what are they supposed to be doing with the customers. And on a weekly basis, very easily can I see, are they meeting these objectives or not? And when they are not, and it's simply like, what's going on, how can I help you, how can I support you? So that's really working well for us.
That sounds great, Quentin. So once again, congratulations to you and your team.
Thank you very much.
Quentin.
Hi, Jorge. Listen, thank you very much for coming into the field to see me. I really appreciate you giving up your time.
My pleasure, anytime. What can I help you with?
So, Jorge, I want to talk to you about SLSM, our new drug that we launched 2 months ago. I'm very happy with what we're doing from an activity point of view. We're calling on the right customers. We got the right reach and frequency. We're having beautiful conversations with our doctors. We're identifying the appropriate patients. So all of that's working perfectly. The piece that I feel is missing with my team is on closing the call. When we ask for the business, we've spoken to the doctor about the appropriate patients. I feel my reps are not really driving that last step through. And I just need to get your support and ideas on that.
Well, what you're expecting from your team sounds very reasonable to me. I think as long as they focused on the appropriate patients and the benefits that SLSM brings to these appropriate patients, then they've earned the right, so to speak, to ask their customers for a commitment to then prescribe for these appropriate patients. So how can I help you pull that through with your team more effectively?
So I just need you to sort of work with 1 or 2 of my representatives, if you can do that, or if you work with me to just see if I'm coaching the skill. Because the first part of the call I'm very comfortable with. We identify the right doctors to call on. The representatives are talking about the appropriate patients. We set up the call beautifully. We have a discussion around the treatment goals. We deliver our key messages. But it's just that final piece then where, the rep almost needs to say, like, so Dr. Jorge, thank you very much for having this discussion with me today. For these appropriate patients, will you please use SLSM? And it's just that final little piece that I need to coach and develop them, and I need your support on that.
Absolutely. You have my 100% commitment that I will support you in any way that I can.
Okay, so thank you very much, Jorge. So if you can work with 1 or 2 of my representatives in the near future, give me some feedback on that. And then when you work with me and the representative as well, just check for me then, Q, are you coaching that final call as we go forward?
I will do that. Thanks so much.
Thank you, Jorge.
Quentin, how are you?
I'm very good. How are you, Jorge?
I'm doing great. I'm doing great. Good. Thank you. So listen, I've been doing quite a bit of analysis across my entire geography. And in particular, I looked and I saw in your district, and I found that there were several territories that are demonstrating significantly strong share and volume growth for SLSM. And I wanted to get your thoughts. Have you seen that? And if so, could you share with me What's going on in those territories? What are you seeing?
Yeah. Well, first of all, thank you very much. And I totally agree with you. I mean, we do a constant analysis of our territory and where we can improve. And StressLax is doing really well across all of our top territories. But to be honest with you, Jorge, we're not doing anything special. You know, of all of the coaching advice you've given us, we're focusing on the basics. We're making sure we're calling on the right customers. We're making sure we hit our reach and frequency targets. We're making sure our representatives are well trained on the product and scientific knowledge. And as you remember, a couple of months ago, one of the things that I wanted you to help me was to look at as the close of the call. You know, I was very happy with the way that my reps were setting up the call, but they weren't asking for the business at the end of the call. Right. So we've been focusing on that a lot, and I'm making sure that when we're having this conversation with the doctor, we give him all the information, we answer his concerns and his questions. We're making sure that it's a fair balance before we move into closing. And now my reps are very comfortable to saying, like, Dr. Jorge, thank you for the great discussion. We've identified the appropriate patients. With all of the data that you now have available, will you please use StressLax for your appropriate patients? So kind of that's basically what we're doing, and it seems to be working well.
Well, that's excellent, Quentin. It sounds like you are doing an exceptional job of coaching your sales professionals in the area of scientific knowledge, in the area of effective activity, and also, very importantly, in how they are going about being of value to their customers. Now, you have 10 people on your team, is that correct?
Yeah.
As you look across all 10 of those territories, are you seeing differences, or what sort of differences are you seeing in those areas from the members of your team?
No, to be honest, once again, nothing significant. I mean, I've got a very experienced team, as you know,
Right.
and across all 10 territories, by focusing on the basics, we're getting it right. But I remember I asked you to work with one or two of my representatives a couple of months ago. Did you have a chance to work with any of them?
I did. And again, your coaching is obviously exceptional, because I observed not only were they closing the call or really engaging customers in a dialogue and focusing on the appropriate patients for StressLax and getting the commitment from their customers on those appropriate patients. I definitely saw that. But I also saw a very, very strong business acumen from every member of your team that I worked with. So I'm very impressed with what I saw when I went out, and so kudos to you and your coaching style. I wanted to ask you, however, what else are you doing with your team? Anything from an activity perspective?
Oh, no. So first of all, thank you, Jorge. You know, we've been doing a lot of work with our team to try and focus on that coaching. So we did a deep analysis of our territory, especially across our top 20 customers. And what we've decided to do as a team, so it wasn't me telling them, they came up with a suggestion, was that we should do an additional one call for each of our top 20 customers. So what we're going to do over the next 3 months is, instead of doing 10 calls a day on our top 20 customers, we're going to do 11 calls a day. And I know it doesn't sound like a lot, but if you think about it, 10 representative, 10 calls a day, an extra call a day. So this is something that we're going to focus on to drive this even further.
That's great. That's great. And as we've talked about before, activity in and of itself is just activity. But because your team is executing in that activity and doing so in a very, very high quality way, as we talked about before, that's why your team is where they are. So congratulations to you and your team, Quentin. Thank you so much.
Thank you very much, Jorge.